So this is for an IV insertion. So the first thing you're gonna do is check the orders to make sure that there is an order to give the patient an IV. So that's what we're gonna do. We're gonna check there is an order to give Mr. Jones an IV. That's what we're gonna do today. Hello, Mr. Jones. My name is Sabrina. I'm gonna be your nurse today. There is an order to go ahead and give you an IV, so that's what we're gonna do, and that will help us give you any medications or fluids you may need. Can I see your armband? And can you state your name and date of birth?
Jeff Hughes, January 30th, 1980.
And do you have any allergies?
I do not.
Are you allergic to chlorhexidine at all?
I am not.
Okay, perfect. So what I'm gonna do is just gather all my supplies. I have my start kit here, my catheter, my dressing, my gloves, and everything is in there. So what I'm gonna do now is I'm gonna open this, and I'm gonna take my tourniquet and apply the tourniquet and assess his veins. All right, Mr. Jones will be a little tight. Okay. Okay, I'm gonna go with this vein. I'm gonna pop my tourniquet. I am now going to, first I'm gonna place my chucks underneath your arm, and we have that there. I am going to prime my normal saline, making sure I leave that in there. And then I'm gonna don my gloves. And I'm gonna clean with chlorhexidine. If Mr. Jones was allergic to chlorhexidine, we would go ahead and use a normal alcohol pad. So I would click this, I'm going to clean in an up and down motion along. And then I'm also gonna clean in a 2 to 3 inch where the dressing will be placed. And I will let that air dry, not fan it or blowing on that. While that is drying, I'm gonna go ahead and reapply my tourniquet. I'm going to open my catheter. Maybe. Oh gosh. I'm going to inspect my catheter for any flaws. No flaws noted. I'm going to insert my catheter. I'm going to move my normal saline a little closer. With my bevel up, I'm going to go ahead and insert using my non-dominant hand to stabilize the vein. Alright, so blood flash was noted. I'm going to go ahead and push the catheter forward. And at the same time, I'm going to go ahead and pop my tourniquet. My needle is locked. And I would go ahead and place that into the sharps container. Going to take the normal saline. I'm just holding onto the hub, not holding onto the catheter. I'm going to go ahead and aspirate for blood. And blood is noted. I'm going to go ahead and now push 3 mLs of normal saline. While I'm doing so, I'm going to note for any redness or swelling along the site, and that is not noted. I'm going to go ahead and lock. Go ahead and undo that. I'm going to now take my dressing while still stabilizing at the hub. I'm going to place my dressing. Oh my goodness. Okay, so I'd place my dressing, and on my dressing I would do the date, time, gauge used, which was a 22 gauge, and my initials. I would go ahead and tape that up as needed as well. I'm going to document that only 1 attempt was made and the patient's tolerance was good. And I'm going to document the date, time, and the location of the IV insertion. And that is that.